Good afternoon, ladies and gentlemen, once again. We are jumping to our panel 5, and we will start with the topic that relates to the pandemic. The pandemic surprised us by enormous speed of spreading. However, some governments neglected initial signs of pandemic, others took it very seriously from the very beginning. We have to take this lesson for future to build up better global preparedness system. And this we are going to discuss with our next briefer. So let me present Mr. Benjamin Tak. Benjamin is an independent consultant and NATO civil expert. Benjamin, it's nice to have you with us. The floor is yours.
Hey, good morning, everybody, and thank you for that introduction. Can you hear me and see me okay?
Yes, we have you loud and clear.
I'm going to hope that that's the case.
We have you loud and clear. We have you loud and clear.
Okay, thank you. I'm going to go ahead and pull up my slides. All right, good morning, good afternoon to everyone, and my thanks to the Crisis Management and Disaster Response Center of Excellence for holding this event, despite the circumstances, to everyone who has helped make it happen, and for the invitation to participate today. I do regret that circumstances do not permit another visit to Sofia, and hope that that will be possible next year to attend the conference. As quick background, I support a Department of Defense program called Civil Military Emergency Preparedness, or CMED, which was founded back in 1992 and works with and in support of NATO partners in the area of crisis management and civil emergency planning. I've also served as a NATO CEP civil expert in crisis management systems, supporting the Civil Protection Group since 2011. So my topic of my remarks today is COVID-19 implications and opportunities in emergency preparedness cooperation. And from my perspective as someone who has worked with partners in these areas for almost 20 years and supporting NATO as an expert, the last few months have been, frankly, quite amazing, if rather sobering. So just a few introductory comments to start things off. First, we are still in the midst of a crisis and very much at an early stage. While I think it's fair to say I feel like I've been in my house for a year, it's really only been 2 months. So staying patient under these circumstances is important. I also think it's very unclear how this is going to play out over the coming months and likely into next year. Hopefully things will move in a positive direction. When I use the term emergency preparedness, this is a general term for an approach to national readiness for a full range of emergencies that is made up of 4 components: whole of government and society, all hazards, civil military cooperation, specifically defense support to civil authority in cases such as this one, and the role of importance of emergency management as in terms of being a function of government as well as a capability. To reduce vulnerability to hazards and cope with disasters. These are 4 key and enduring elements of the approach of the program that I support in working with other nations to build national level preparedness and response capacity. And lastly, I need to add the usual disclaimer that I support DoD as a contractor and my remarks are personal in nature and don't constitute US or DoD policy. I'd like to highlight just a few of the observations on this slide. First, this has truly been a global emergency without precedent, with impacts far beyond any previous public health emergency. The 2003 SARS epidemic and the 2014-2016 Ebola outbreaks have provided ample warning of the potential threat posed by such events and the need to enhance preparedness at all levels. I think it's important to note that during the SARS epidemic in 2003, the airlines moved 1.66 billion passengers while in 2018, that figure had risen to almost 4.3 billion passengers. And I would assume that in last year, that figure was even higher. This vast increase in mobility around the world means that the chance of a disease spreading globally would be significantly higher. And I think that that proposition has been borne out. The magnitude of this emergency is quite staggering. And the only recent event that I would argue had a comparable impact and consequences from a global perspective, albeit very different ones, was possibly the end of the Cold War. Indeed, the actions taken and the civilian level of effort by nations to counter COVID-19 bear some similarities to what was envisioned necessary in terms of civilian readiness should major conflict have broken out in that era between the superpowers. In responding to this pandemic, we've seen nations take actions such as those I've listed, and it's not a comprehensive list by any means, that might have been considered possible, but not probable until this crisis emerged. Of those actions, I think that one of the most interesting ones that I've seen is the contributions of national armed forces to support response have been quite notable, and particularly the use of medical capabilities as augmentation for civilian health care systems. Lastly, COVID-19 has exposed significant weaknesses in preparedness and response at national and international levels. To make just a comment about our response here in the United States, I wrote in an article about 14 years ago on U.S. SARS response, in which I noted that the U.S. had demonstrated that the preparations for biological attack in the aftermath of the anthrax attacks had improved the capability of public health to respond to disease outbreaks, that improved coordination and communication between the medical communities and local, state, and federal organizations resulted in the rapid identification of individuals infected, limited the total number of cases, and prevented the disease from becoming a significant problem. Unfortunately, this has not been the case with COVID-19 response here in the US for a wide range of reasons, and we're paying heavily for it. So two other response observations I'd just like to comment on briefly with this slide. First, while I'm an observer, not a practitioner of geospatial technologies or GIS, I've been observing this technology developed for over 15 years, and it has been an essential part of the CMEP program partner cooperation, both from a bilateral perspective and from a regional perspective. From my perspective, COVID-19 has established the absolute importance of this technology and validated its role as a key tool in supporting response, whether used in government, the private sector, and elsewhere. The number of nations that have established GIS-based national portals or dashboards has been extremely impressive as well as informative, providing really global situational awareness on a daily basis, if not even more frequently. And hopefully there will be a comprehensive look at how GIS capabilities have been leveraged in this crisis by nations in the international community to further develop this capability for future incidents. With regards to NATO, I would just like to comment that the Alliance has been extremely well served in this event by its approach to crisis management and resilience, which have become firmly institutionalized both within the NATO structure as well as within many nations. The value of alliance-wide strategic exercises such as CMX, fostering NATO national crisis management interoperability and integration, and most recently in 2016 with establishing the 7 resilience baseline requirements, all contribute to alliance and national readiness for crises, regardless of their type. Hopefully nations will provide their lessons learned as relates to crisis management and resilience that can support further refinements to existing procedures and initiatives as the lessons learned from this crisis are useful both in terms of the collective defense mission as well as overall preparedness. Lastly, with regards to the NATO Euro-Atlantic Disaster Response Coordination Center, the EADRCC, I would encourage everyone to read the recently published Atlantic Council article, which captures its many contributions in its 22 years of existence and makes a strong case for its continued value and contributions. While there's been some discussion on the need for NATO to have a disaster response coordination node like this, like the EADRCC, I believe that it has demonstrated its value in this situation, and my hope is that this experience will result in greater support from within NATO headquarters, as well as nations for its mission, organization, and activities such as its annual exercise, and potentially post-COVID focused initiatives. So the bottom line of this slide is that COVID-19 has demonstrated that the threat of a global pandemic is real, and that another one has to be considered as a viable threat. I would just ask everyone to consider the impact if a disease with a much higher death rate managed to spread globally as occurred with COVID-19. To be prepared for a future scenario, there will need to be greater emphasis on international cooperation as well as national level planning. A key aspect of future preparedness will be to gain a more complete picture of the multiple logistical requirements so that shortages in the supply chains that we've witnessed so far are not repeated. These are just a few of what I'm sure are many elements that will need to be considered going forward, both at national and international levels. So this is my final slide, and I'll just highlight a few points. First, capturing lessons learned as well as implementing changes, both in the short and the long term, is essential. One issue the program I support is already examining is supporting nations we work with in the conduct of national level COVID-19 after action workshops. For events such as these, we leverage from the field of emergency management to conduct a robust and thorough after action report or a review that documents key issues, develops recommendations, and implementation of needed actions through the continuous improvement process. Second, preparedness for pandemics has been perceived as largely a health or medical community problem. Going forward, this paradigm or this approach needs to change so that pandemics and their challenges are more fully integrated into national level preparedness efforts and to help ensure their priority. And lastly, U.S. bilateral support to partner capacity building related to preparedness encompasses a broad range of topics such as natural disasters, floods, fires, and earthquakes, CBRN, as well as pandemics, and includes efforts that range from working with nations at the highest level, at the national level, even down to local levels. Bilateral funding and efforts for these is significant and is provided by a wide range of organizations across our government, both civilian and military. An ongoing challenge to these disparate efforts is the lack of an overarching approach with clear objectives supported by unified interagency implementation. There are a lot of reasons why this situation exists, and COVID-19 might provide the opportunity to address them and provide a more rational approach to U.S. support. So this concludes my presentation. My thanks for the opportunity to participate, and I'm happy to take a stab at any questions either now, later in the day, or offline. Again, thank you very much to the CMDR COE for organizing this event, and I hope to be able to present next year in person in Sofia. I understand we were running a little bit behind, so hopefully my presentation has helped make up a little bit of that ground. Thank you very much.
Thank you very much, Ben. It was great. Everything was okay. And I have to assure you that we will welcome you in Sofia anytime you can come to us, of course, in real time. And I also share your opinion that the lessons identified, which were captured, we must analyze, and of course, the clue is to share to each other, regardless the country or state. Let me ask you just maybe one question. From your perspective, do you think that the response to the COVID, the international cooperation was efficient? I mean, we have some examples, very positive, like common sharing of results of work to discover the vaccine. But we have also the other side, some countries blaming the other ones. So how it looks from your perspective.
Hang on, I'm having trouble hearing you. Let me try and oh. Okay, hang on a second. Let me mute that and let me put my mute on. I didn't have a chance to do that, and have you repeat the question if you don't mind.
Sure. My question is, do you think that in response to the COVID, the international cooperation was efficient? I mean, some countries were blaming each other, and we have some positive as well examples like sharing of the development works when it's going to be to development of the cure of the vaccine. So what is your opinion?
So I'm still having trouble hearing you, but I think your question just relates to international cooperation. You know, this is actually, I think it's a mixed bag, to be honest. I think there are some positive aspects, and I think there are obviously a number of areas that could have been improved. I haven't really had an opportunity to really dig down into what has worked and what hasn't to this point. I think one of the most, the one area that I think has been very interesting to watch is actually the connection between, is actually in the geospatial world. The cooperation between nations and ESRI has been quite amazing, because I believe, my understanding is that ESRI has provided a lot of support to nations in terms of building national portals, and I've been quite that's actually the one area that I really kind of tried to watch, and that's been one of the most impressive areas, I think, coming out of this, is to be able to see really largely in real time nations posting their information, being able to look at the different data sets and to get a sense of where nations are standing with regards to their response. You know, that's all driven by whether data is accurate or not, but with that caveat, it's still been, that is one area which I think has been really, really positive. Hope that helps.
Thank you very much, Ben. Thanks a lot. Once again, we will welcome you in Sofia anytime. And by the way, very nice library behind you. I like it. Greeting from Sofia.